Narcotics have special parameters in place around the administration, disposal, and documentation. But how clear are you on your facility's policies? Hey, my name is Nurse Key, and welcome to New Nurse Bootcamp, where I'm taking the sting out of being a new nurse. So, narcotics is defined as a medication that acts on the central nervous system to relieve pain by blocking pain signals and altering the perception of pain. These medications can cause not only pain relief, sedation, but also can slow breathing. So that's why there's special parameters around them and have to be monitored in a certain fashion. These medications can include morphine, Dilaudid, oxycodone, fentanyl, codeine, and methadone. As a nurse, given a narcotic, you have to consider a few things for administration. What is their pain score? Their respirations, are they within normal parameters because it can drop the breathing rate? And what's the blood pressure? Because a lot of pain medication can drop your blood pressure too. So if it's already soft or a little bit on low side, you may have to reconsider that medication or give something else, or just continue to monitor it, just depending on what the situation is and that medication is necessary. All right, so handling narcotics, most facilities have their own special guidelines on the timing of this, so you have to check with your facility. But most facilities want you to pull the medication with the order present, and certain medications may have a parameter of, if the pain scale is 7 to 10, give this medication. If it's 3 to 6, give this one, or 4 to 6, give another medication, and then 1 to 3, give this medication. So make sure it falls within that criteria based on pain. So you pull the medication. Every facility requires you to give it within a certain time frame. It could be 15, 30 minutes or an hour, and then you have to waste that medication within a certain time frame as well. So generally, when you pull a medication, you don't need two nurses for most medications to pull it. But if you waste it, which wasting means that the medication actually comes in a certain volume, and the physician or the nurse practitioner only prescribed or ordered a certain dose, which is less than the overall container that you pulled, you have to waste some. You can't give the patient the whole container just because it's present. So to waste a narcotic, in almost every facility, you have to have two nurses, two RNs to waste a certain medication. And depending on the facility, you may waste at the Pyxis or the Omnicell, or at if it's paper charting, you'll waste it in the chart. Either way, you'll document it based on how your facility has ordered you to, and it's really best once you pull it at whatever your medication station is, just go ahead and waste it right there so you don't overgive any medication, or you don't forget to waste it after the time frame that your facility has given you. Now, then you'll document it within real time, right? Because most facilities, like in the hospital, you're required to scan your medication. So you'll scan it and they'll document it right there as you're giving it. Now, where can you waste these medications? Most of the facilities now have a narcotic bin or a container within the med room or on the unit. It may be black, it may be red, or some facilities have you waste it in the sharps. Either way, find out your facility's protocol and waste it and act accordingly.